Welcome to everyone. Welcome to the first targeted topic in our new educational series from the Wellness Blueprint. This series is designed specifically for all of us, our colleagues out there in the medical field, to help us stay at the forefront of new developments and all that. So today we're going to dive deep into something pretty fascinating, the connection between gut health and metabolic health. And we're going to explore some really groundbreaking breakthroughs in how we treat metabolic conditions like type 2 diabetes and obesity.
It's great to be here.
I have to say, getting ready for this deep dive, I was really struck by just how much influence the gut has on the whole body. Like, did you know that enteroendocrine cells, the ones that produce all those critical gut peptides, they only make up 1% of the gut lining, but they act like this massive control center with both local and systemic effects. It's pretty remarkable.
It really is, and it really underscores why we are seeing such a surge in research focused on the gut microbiome and its connection to overall health. It's not just digestion anymore.
Exactly. So let's start with a look at the current state of metabolic health. As we all know, the rates of obesity, overweight, and type 2 diabetes, they're skyrocketing. And unfortunately, that's putting a huge strain on our healthcare system.
It's true. The economic burden of managing these chronic diseases with the traditional approaches is enormous.
Yeah.
We're spending billions of dollars every year on medications and treatments that often only address the symptoms, but not the root cause.
It's a difficult reality.
Yeah.
But I am encouraged by some good news on the horizon. We're seeing some groundbreaking therapies emerge that are revolutionizing how we think about metabolic health.
Exactly. And one of the most exciting areas of research is the gut microbiome. Remember that landmark study where obese mice became thin and thin mice became obese simply through fecal transplants from human twins?
Oh, yeah, that was a real eye-opener.
It really demonstrated the gut microbiome's powerful influence on metabolism and sparked so much new research.
So how does that work? What's going on at the cellular level that connects gut bacteria to things like obesity?
Well, specific gut bacteria actually stimulate the release of GLP-1. As you know, this is a key hormone for regulating blood sugar and appetite. And one bacteria in particular, Akkermansia mucinophila, plays a dual role. Not only does it produce GLP-1, but it also helps to maintain the gut lining's protective mucin layer. So it's both a producer and protector, which is fascinating.
I've heard a lot about Akkermansia mucinophila lately.
Yeah.
I even came across a clinical trial published in the BMJ about a 5-strain probiotic that included that strain.
Yes, that's right. And the results were quite promising that probiotics successfully lowered A1C and reduced blood glucose spikes in type 2 diabetes patients. So this kind of research is showcasing a whole new frontier in probiotic treatment, I think.
That's exciting. It seems like we're just scratching the surface of what's possible with these microbiome-based therapies.
We are. And speaking of new frontiers, let's transition to talking about incretin-based pharmacotherapies. These medications are designed to mimic the effects of the very gut peptides we were just discussing.
Okay, let's unpack this a bit. We know there are a few different types of incretin-based medications. Could you give our listeners a brief overview of those?
Absolutely. So you have GLP-1 receptor agonists like semaglutide, which have very positive effects on blood sugar, weight, and even cardiovascular health.
I've certainly seen some impressive results with semaglutide, but I know there can also be some gastrointestinal side effects. How do you generally approach those in your practice?
It's true, nausea and vomiting are common, but thankfully they often subside with continued use. It's also important to remember that we now have dual GIP/GLP-1 receptor agonists, like tirzepatide, which can be even more effective in terms of weight loss and glycemic control compared to GLP-1 agonists alone.
And tirzepatide is showing even greater promise in terms of weight loss, correct?
Yeah.
Have you seen that in your own practice?
Yes, absolutely. And then on the horizon, we have triple GIP/GLP-1/glucagon receptor agonists like retatrutide, which are still in development, but the early data is incredibly promising, particularly in terms of weight loss.
Triple agonists.
Yeah.
Wow, that's remarkable. Can you tell us a bit more about how those work?
Of course. So these triple agonists work by activating not only the GLP-1 and GIP receptors, but also the glucagon receptor. This leads to a multifaceted effect on metabolism, enhancing both insulin secretion and sensitivity while also suppressing glucagon release.
That's fascinating. And it really highlights how much progress has been made in this area of research.
It does. And it's important to remember that we also have another class of drugs that can complement incretin therapies, amylin analogs. These work by slowing gastric emptying and increasing feelings of fullness, which can make them a valuable tool for weight management, especially when used alongside a GLP-1 receptor agonist.
So with all these different medications coming onto the scene, it can be a bit overwhelming to keep up with the latest developments,
Mhm.
even for seasoned clinicians like ourselves.
Hmm.
How do we make sense of it all and incorporate these advances into our daily practice?
That's a great question. I think it can be helpful to consider the ominous octet model, which highlights 8 key factors involved in type 2 diabetes. I like to envision it as web where each factor is interconnected and influences the others.
The ominous octet. That's a striking term. I can see how that imagery would help conceptualize the complex interplay of factors in type 2 diabetes. Can you break down those 8 factors for our listeners?
Of course. The 8 factors are decreased insulin secretion, increased glucagon secretion, increased hepatic glucose production, decreased glucose uptake neurotransmitter dysfunction, increased lipolysis, increased renal glucose reabsorption, and of course, inflammation.
So it's not just about addressing high blood sugar. It's about understanding and tackling all these different factors that contribute to the disease.
Exactly. And that's why we need to move beyond just focusing on a single aspect of type 2 diabetes and embrace a more holistic approach to treatment. This is where those new drug classes we discuss can be so impactful. But as we'll talk about more later, it's crucial to not lose sight of the importance of lifestyle changes for our patients.
That makes a lot of sense. So where do we go from here? How do we optimize our treatment strategies for our patients, given this complex and interwoven web of factors you described?
That's what we will be discussing in part 2 of this episode. So we've talked about all this science, behind this gut metabolism connection. But now let's bring it back to our clinical practice. How can we actually use all this new knowledge to help our patients achieve optimal metabolic health?
That's the million-dollar question, isn't it? For me, I think it starts with understanding that there's no magic bullet here. We're not going to find, one single solution that will work for every single patient. It's about integrating these new discoveries and treatment options into the toolkit we already have.
I agree. We absolutely cannot lose sight of those foundational lifestyle modifications. Nutrition, exercise, sleep, stress management, those are still the cornerstones of good metabolic health.
Right. But now we also have this incredible new understanding of the gut microbiome and these powerful new medications that can help us go even further and achieve even better outcomes for our patients.
It's about using all the tools we have in a strategic and personalized way. For example, if we have a patient who is struggling with weight loss, we can delve deeper into their gut health and see if there are specific interventions that might be beneficial.
What kind of interventions are you thinking of?
Well, it could be dietary changes incorporating prebiotics or probiotics, or even considering something like fecal microbiota transplantation in very specific cases.
Fecal microbiota transplantation. Isn't that still considered experimental? I know there's been some fascinating research in that area, but I haven't seen it widely adopted in clinical practice yet.
It is still considered experimental for many conditions, but it's showing incredible promise for a variety of conditions, including obesity and metabolic syndrome. I think as we learn more about the gut microbiome, we'll see FMT become a more mainstream treatment option.
That's exciting. It really does feel like we're on the cusp of a paradigm shift in how we approach these conditions.
I agree. And of course, we also have these new medications that we've been discussing, like semaglutide and tirzepatide, that are helping people achieve significant weight loss and improve their metabolic health in ways we really haven't seen before.
That's certainly been my experience as well. But as we mentioned earlier, those medications can be expensive, and not all patients have access to them. That's something that weighs heavily on my mind. How do we ensure that these groundbreaking treatments are accessible to everyone who needs them?
That's such a critical point. And it underscores why we need to continually emphasize those lifestyle modifications as the foundation of our treatment plans. Those are changes that everyone can make, regardless of their financial situation or access to healthcare.
So it really is about taking a holistic approach, isn't it?
Yeah.
Addressing all aspects of a patient's health,
Yeah.
not just focusing on their blood sugar numbers or their weight.
Precisely.
Hmm.
We need to consider their gut health, their dietary habits, their exercise routine, their sleep patterns, their stress levels. It's all interconnected. Remember that ominous octet visual?
Right? We can't just treat the disease in isolation. We have to treat the whole person.
Exactly. And that means empowering our patients to take control of their own health, giving them the tools and knowledge they need to make sustainable changes that will benefit them long term.
That reminds me of a patient I saw recently who had been struggling with her weight for years. She had tried every diet imaginable, but nothing seemed to stick. We started talking about her gut health and her stress levels, and we made some simple changes to her diet and her sleep routine. And you know what? She started losing weight without even trying.
I love hearing those success stories. It's a powerful reminder that sometimes the simplest changes can make the biggest difference.
It really can. And it highlights the power of that human connection in medicine. We're not just prescribing medications, we're educating, motivating, and supporting our patients on their journey to better health.
That's where the real magic happens, I think, in that space between clinician and patient where we build trust, share knowledge, and work together to create a plan that's truly personalized and sustainable.
I completely agree. It's been such an insightful conversation, and I'm already thinking about how I can apply these new strategies in my own practice.
Me too. It's exciting to see how much progress we're making in this field, and I can't wait to see what the future holds for metabolic health management.
Well, I know our listeners are eager to hear more about those specific medications we've been discussing. So why don't we transition now to a more in-depth look at the various incretin-based pharmacotherapies available.
Sounds good to me.
Okay, so we're back now for the final part of our deep dive into gut health and metabolic health. And I'm ready to get into the specifics of these incretin-based medications. I know that many of you are already using some of these in your practice, but there have been so many new developments lately.
Absolutely. And I think it's helpful to start by clarifying, the different types of incretin-based therapies that are currently available. We've touched on them briefly throughout the episode, but let's break them down a little further.
That sounds great. So first up, we have the GLP-1 receptor agonists.
Right. These medications, as you know, mimic the action of GLP-1, that naturally occurring hormone that stimulates insulin release and slows gastric emptying.
And one of the most well-known GLP-1 receptor agonists is semaglutide, correct?
Yes, semaglutide is a great example, and it's available in both injectable and oral formulations. And as we've mentioned, it has shown really remarkable efficacy in reducing HbA1c and promoting weight loss.
I've certainly seen those impressive weight loss results firsthand with some of my patients. But what about the side effects? Are there any specific strategies you use to manage those?
The most common side effects are gastrointestinal nausea, vomiting, diarrhea. But these tend to be dose-dependent and often improve with continued use.
So starting with a lower dose and gradually titrating up can help minimize those side effects.
Exactly. And it's also crucial to have, open and honest conversations with our patients about these potential side effects. Reassuring them that they often subside over time can go a long way in improving adherence.
That's an important point. We don't want patients to discontinue a potentially life-changing medication because they're afraid of some temporary discomfort.
Absolutely not. Now let's move on to the dual GIP/GLP-1 receptor agonists. These medications are particularly fascinating.
Yes, I've been hearing a lot of buzz about tirzepatide in particular.
Yeah.
It seems to be setting a new standard for weight management, wouldn't you say?
Tirzepatide activates both the GLP-1 and GIP receptors, which, as we talked about earlier, leads to even greater improvements in blood sugar control and weight loss compared to GLP-1 agonists alone.
And in terms of side effects, are they similar to the GLP-1 receptor agonists?
Yes, generally speaking, the side effects are similar, primarily gastrointestinal in nature. But again, careful titration and patient education are key to managing them effectively.
Okay, now this is where it gets really interesting for me. The triple GIP/GLP-1/glucagon receptor agonists. Retatrutide is the one that comes to mind.
That's right. Retatrutide is still in clinical development, but the early data is incredibly promising. It suggests even greater weight loss potential compared to the dual agonists, which is remarkable.
Triple agonists, wow.
Yeah.
That's really pushing the boundaries of what we thought was possible just a few years ago.
Yeah.
I'm curious about the mechanism of action there. How does activating the glucagon receptor contribute to weight loss? I would think that it would raise blood sugar levels.
That's a great question. And it might seem counterintuitive, but in the context of retatrutide's triple action, activating the glucagon receptor actually seems to enhance energy expenditure and promote fat burning without causing, significant hyperglycemia.
So it's about harnessing the power of